Did you know that heart disease is the leading cause of death for both men and women in the United States? It's alarming to learn that one person dies from heart disease every 36 seconds. While heart attacks and strokes often seem sudden, the truth is that heart issues don't develop overnight. They usually start with subtle symptoms that can easily go unnoticed. Recognizing these early warning signs is crucial in preventing serious heart problems. In this video, we'll walk you through 15 early signs that might indicate you're at risk for heart disease. By staying informed and attentive to your body, you can take action early and possibly save your life. 1. Chest discomfort. One of the most obvious signs of an unhealthy heart is chest discomfort. This sensation, also known as angina, feels like pressure, pain, pinching, or burning in the chest. It's important to note that this discomfort doesn't always happen during strenuous activity. It can occur at rest or even during sleep. If you feel this type of pain, it's essential to pay attention. Even if the pain isn't severe, it could be a sign of serious heart trouble that needs to be checked out by a doctor. 2. Upset stomach. An upset stomach might seem unrelated to heart health, but it can actually be an early warning sign of heart disease. Symptoms like stomach aches, vomiting, or acidity are often dismissed as the flu or indigestion. However, if you experience these symptoms without a clear reason, such as after eating something that shouldn't have caused them, it's worth getting checked out. Women, in particular, are more likely to experience stomach issues related to heart problems. 3. Left shoulder pain. Pain in the left shoulder or arm can be a sign of heart trouble. This happens because the nerves in the left arm and heart send messages to the same pain centers in the brain. As a result, your brain might interpret heart trouble as pain in the arm or shoulder. This is known as referred pain. If you experience persistent pain or pressure in your left shoulder, especially if it's accompanied by other symptoms like shortness of breath, seek medical attention immediately. 4. Leg pain. Leg pain, especially a cramping sensation during physical activity, can be a sign of peripheral artery disease, PAD. PAD is a form of cardiovascular disease where the blood flow to your extremities, such as your arms and legs, is restricted. The pain usually subsides with rest, but it's important to mention these symptoms to your doctor. PAD is more common in smokers and people with diabetes. 5. Unexplained fatigue. Feeling tired after a long day is normal, but feeling completely exhausted after doing something as simple as getting dressed is not. Unexplained fatigue can be a sign that your heart isn't pumping enough blood to your body's tissues, leading to a lack of oxygen. This is a common symptom of cardiovascular disease, and women are more likely to experience severe fatigue before or during a heart attack. If you're feeling unusually tired for no apparent reason, it's time to talk to your doctor. 6. Random cold sweats. Sweating is a natural way for your body to cool down, but cold sweats that occur without any physical activity can be a warning sign of heart problems. If you find yourself breaking out in a cold sweat, especially if it's accompanied by chest pain, it could be your body's way of responding to inflammation around the heart. This is a serious symptom that should not be ignored. 7. Persistent cough. A persistent cough that doesn't seem to go away could be a sign of congestive heart failure. When the heart isn't pumping blood efficiently, fluid can build up in the lungs, causing a chronic cough. This cough might be accompanied by shortness of breath, which is another sign of heart trouble. If you've had a cough that lingers for weeks, it's important to consult your doctor, especially if you notice other symptoms. 8. Dizziness or lightheadedness. Feeling dizzy or lightheaded can have many causes, such as dehydration or standing up too quickly. However, if you experience these symptoms regularly, it could be a sign of a heart issue. Dizziness can be caused by a blockage in the arteries, low blood pressure, or faulty heart valves that aren't maintaining proper blood flow. If you frequently feel like the room is spinning or you're about to faint, it's important to get checked out. 9. Shortness of breath. Shortness of breath is another symptom that can easily be overlooked. If you find it hard to breathe or feel like your lungs aren't working as they should, it could be a sign of heart disease. This symptom might develop gradually or come on suddenly, and it's often a sign of a serious heart condition like aortic disease, arrhythmia, or heart failure. Shortness of breath is never something to ignore, especially if it happens during everyday activities. 10. Anxiety. Anxiety is a common experience for many people, but if you have heart problems, you might experience anxiety along with heart palpitations. Studies have shown that people who suffer from extreme anxiety early in life are more prone to heart disease later on. If you frequently feel anxious or notice your heart racing for no apparent reason, it's worth considering whether your heart health could be the underlying issue. 11. Swollen ankles. Swollen ankles or feet can be a sign of heart failure. When the heart isn't functioning properly, fluid can build up in the lower extremities, causing them to swell. While there are other reasons your feet might swell, such as pregnancy or standing for long periods, persistent swelling should be checked by a doctor. It could indicate a more serious issue that needs medical attention. 12. High cholesterol. High cholesterol is a well-known risk factor for heart disease. Cholesterol is a fatty substance found in certain foods and produced by your liver. When you have too much cholesterol in your blood, it can build up in your arteries, leading to blockages that increase your risk of heart attacks and strokes. Keeping your cholesterol levels in check is essential for maintaining a healthy heart. 13. Sleep apnea. Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep. This condition is often associated with loud snoring, but not everyone who has sleep apnea snores, and not all snorers have sleep apnea. Sleep apnea can be particularly dangerous because it can lead to prediabetes and increase your risk of heart disease. If you suspect you have sleep apnea, it's important to get tested and treat the condition to protect your heart health. 14. Lack of stamina. Exercise is great for heart health, but a sudden change in your ability to exercise might be a warning sign. If you find yourself getting winded or fatigued more quickly than usual, it could be due to an underlying heart condition. Even if you lead an active lifestyle, it's important to pay attention to any changes in your stamina and consult your doctor if you notice anything unusual. 15. Depression. Depression is a common mental health issue, affecting millions of people each year. While it might not seem related to heart health, studies have shown that people who are depressed are at a higher risk of developing heart disease. Additionally, those who already have heart disease are more likely to experience depression. If you're feeling down or struggling with depression, it's important to seek help. Addressing your mental health can also have a positive impact on your heart health. While these signs can help you identify potential heart issues early, one of the best ways to keep your heart healthy is by adopting a heart-friendly lifestyle. This includes eating a balanced diet, exercising regularly, avoiding smoking, and managing stress. If you experience any of these symptoms, don't hesitate to seek medical attention. Your heart is too important to ignore the warning signs. While you're focusing on your health, be sure to visit our sponsor, HealthKick. We provide an extensive array of products to enhance your wellness journey, from health awareness tools to fitness gear. Explore their store at healthkick.store to discover what they have to offer and take steps towards a healthier you. Stay informed, stay proactive, and take control of your health. Please like, comment, and subscribe. Thanks for watching, and we'll see you in the next video.